Good morning, students. It's good to have you in my kitchen again today, and we're going to do part 2 of our IV therapy. But first, I want to call your attention to some things that I found that I did not do yesterday. There were 3 things, so let me say that to you. When I first came into the room to start the IV, I did not check the patient's ID band. She did not have an ID band on. I had forgotten to put one on her, so be sure to check that. Also, I did not do the assessment to assess for edema and the jugular vein distension, or even listen to her heart sound. To her lung sounds. But I will do that today before we actually start IV fluids. And then the last thing is that I failed to warn the patient that I was going to stick her. So when I had the catheter ready to go in to pierce the skin, I did not warn her of that stick. And that's very important so that your patient does not startle and maybe jerk their hand, and you may accidentally stick them in another site, another place, and cause injury. So be very careful and always warn the patient. Okay. With that aside, then we're going to go ahead. I'm going to go to the nurse's station, and then we'll go from there. I guess one of the doctors has my chair. That happens a lot, but that's all right. I'm just going to take a look here in the chart, and I see get her medication administration order out, and we'll look at these medications that the doctor has ordered for Miss Bird. All right, we're going to open up my medication drawer, and I see that we need some Lasix. So I'm going to get the Lasix out, and we're going to need 20 milligrams, and I can see that we have enough in this vial, and it is going to expire 3/25, so we have a good date for that. So I'm going to set that aside, and then we also need Rocephin, and we've got 1 gram of that for Miss Tweety Bird, and the pharmacist says to infuse this over 60 minutes. All right, so we got the same name, we got the same medical record number. So this is our first medication check. So I'm going to close our drawer, and I'm going to sit this right here. Okay. Now then, first I'm going to go ahead and wash my hands. Make sure we get it good and dry. Okay, now then. I'm going to open up. Now this is what you have in your skills bag. You used this for your video last semester. But you have a 3 cc syringe and a needle. So I'm going to go ahead and attach that. I'm going to take my alcohol, and we're going to scrub the top for at least 15 seconds. Okay, so 15 seconds. Let that be drying. And I'm not going to tell you how much air I'm putting in. I'm not even going to tell you how much I am withdrawing. In fact, I'm going to do something completely different than what is correct, because I want you to be able to show me that you have the correct amount. Okay. Now I did not truly draw up any, because remember I said we're going to just probably keep this a dry procedure. Okay. Now then, so I want to scoop this back on and click it into place. Now, oh, it's not fitting very well. Let's try that again. See if I can get it. Oh, I see. wrong way. Okay, now I know that you only have one syringe. So what I thought about this morning, because you're going to need some flush, I took a straw. It was still in its little wrapper, and I cut it in two so that this can be my plunger, and I can pretend that I am flushing. So if you want to get you a straw and cut it in two, that will work great. If not, you're going to have to just be doing a lot of flushing, giving your medicine, flushing with the very same syringe. Okay, so got that, and then here is my bag of Rocephin. So I need to open up this drawer, and I need to get out a bag of normal saline, and I see that it expires 5/22. And I've got tubing right here. Let me tell you something. Just last week, what happened to me, I was getting ready to do my infusion, and I had put my electrolytes into my bag of fluid and one vial of my vitamin C. Now this vial of vitamin C is $35. Okay, I noticed that when I was getting the air out of the bag, that it was more air than usual. And I thought, what is the problem? Well, I looked, and my IV solution had expired. It was like sometime in 2019. But see, I had looked through all of my IV solutions probably about 3 weeks ago, and everything seemed to be 4/22. So I didn't even really pay attention because I had already gone through the solution. So that just serves, to tell me from now on, I will always look at that expiration date. So let me encourage you to always look at your expiration date. Now, when we do an IV piggyback, and that's what the Rocephin is for, our patient does not have an IV infusing already. So we have to make her a primary infusion. Even though it will not have to stay with her, once her IV piggyback is finished, we'll disconnect it and we'll leave it hanging in her room until the next time for her IV piggyback. Okay, so we need to get our tubing. And I see I've got let me close this door. Y'all don't want to see my laundry. I've got my IV pole hanging over here. Let's see. Now I've got, I've got my primary tubing. I'm going to get it out of my packaging. And I'll go ahead, and it may have some kind of little, not a twisty tie like what I use, but some other like little piece of paper that holds it together. Okay, and this, I added this morning. This represents the roller clamp, and this will close up the tube or open up the tube. Alrighty, so I'm going to take my normal saline, and I'm going to spike this. Now, this tubing has a sterile cap on it, so you will take off the sterile cap, and then you will have to pull off the part that's on the bag and connect it. On the video that I do from school, I will be going through this and using the real tubing and the real bags, and you'll be able to see that. Okay, so now then, I'm going to, okay, this is the end of my tubing. So let me hang this up on the pole so I can prime the tubing. And I'll remember to, well, what did I do? Oh. It failed. And I remember we're going to put it on the lower part of the hanger here. Okay, now then. And this is, you want to, as soon as you take your tubing out of the bag, go ahead and put the roller clamp in the down position, so that when you hang up your fluid, you don't get all these bubbles and things. But you'll need to press the drip chamber, get some fluid in it. Alrighty, and then I've got my sink over here, and I'm gonna open up the roller clamp, and I'm gonna watch all the fluid go down, and then a couple of drops will come off, and I can look and I can see I have no air, and I'm going to roll it back down. Okay, and I'm just gonna drape this over. Okay, now then I need to get my secondary tubing out, and inside your secondary tubing bag, you'll have your tubing, and you will also have a little hanger, so that on your IV pole, if you need to lower your primary fluid, you can use your hanger to do that. Okay, let me get my tape so I can spike it. And again, go ahead and put on the roller clamp, do it in the down position. So in a sterile manner, you're going to spike this little bag, and let me get it hanging on my IV pole here. Hang it up here. Okay. Alrighty. And I see that I need to I'm going to hold it in my hand because the tubing is so much shorter, it would not reach over to the sink. So let me press on the drip chamber, roll up your roller clamp, and let the fluid, and you want to be careful because this is your antibiotic and you do not want to waste a single drop of it. So you watch it very carefully. I'm going to go down because so I get it just right to the end of the tubing. Okay, now then we can attach this here. Okay, and these tubings have protective caps on them. So you'll take off the cap, and then you want to you reach over here and get my alcohol. Okay, and then on the port here, you want to clean this port with alcohol, scrub it 15 seconds, and then you will push in and turn, so lure lock. Okay, now that is connected, and there's a Y, except it's probably below the clamp. Let me put that in a more realistic, well, tape is too tough. That would more than realistically would have been here, right here. But that's okay, we're not going to worry about that. But when you do yours at home, if you will put your, make your Y point, I can't even say port, have it below your roller clamp. Okay, so that's ready to go. Now let's check do a number 2 check. So we've want to make sure. Okay, I have and I labeled my syringe with Lasix. Now you might want to do like what Miss Williams told you about putting your medication in a Ziploc bag and putting all your labels on it. That is absolutely fine. That was a great idea that she had. I chose to just put a label on my syringe of my medicine. So I'm checking it. Lasix 20 milligrams and Lasix 20 milligrams, and then my Rocephin 1 gram infused. Okay, so already I feel confident that I have got the correct meds for Miss Tweedyberg. So now then, let's go to, I'm going to get my IV pole so I can, she did not have one in her room yesterday, so I'm going to take this one with us, and I've got her medical records, her med administration record, And I'm going to take my stethoscope because remember, I need to do some assessment. And let's see, I'm going to need my flush, my medicine. Let's see, is there anything else? Okay, I'll take some alcohol. All right. Okay, so I'm going to come here and I'm going to put her IV pole right here. Okay. Good morning. How are you today? Did you have a good night? Get me some hand wash. I'll lay this down right here. Rub it in till it's completely dry. And get a little sterile drape to put on the table and put my supplies on it. Keep them nice and clean. And we've got your IV medications, but first I need to check your armband. And you are, okay, Tweety Bird. And your date of birth, Miss Bird? 9/27/50, okay. And it says your medical record number is 01245, 01245. And I've got your Lasix, 20 milligrams, IV push. And over here, I hung up your IV fluids, and you've got Rocephin, 1 gram for Miss Tweety Bird. Okay, and the pharmacist says to infuse that over 1 hour. I checked that in the drug book, and I saw that that was an appropriate rate to do the Rocephin. And then I also checked on my Lasix and saw that this particular amount, 20 milligrams, could be infused slowly over 1 minute. Okay, I'm going to put some gloves on. Alright, so I'm going to open up some alcohol because we will need to scrub the port for at least 15 seconds. So not just on the top, but around. I like to pinch it around the thing right here. So scrub that for like 15 seconds. And while that's drying, I'm going to get my first flush. Now this has, this is a 3 ml flush. If you remember when we first started the IV, I used a 10 ml flush. But for just routine medications and routine flushing, all you will need is a 3 ml syringe. So you'll take off the sterile cap that's on the end of the flush, and you're gonna push in and turn. Okay, and then you will need to aspirate. It seems pretty hard. I'm not getting anything. Oh, maybe if I unclamp it, it might work better. Okay, so be sure to unclamp it. Now let's try. Still not getting anything. Sometimes on the newer injection ports, you're not able to aspirate any blood. And also if your diameter of your IV catheter is very small, you may not get any blood back. But that does not mean that your catheter is out of the vein. So we're going to slowly push this flush and watch for swelling here at the site. So let's push. Okay, Miss Bird, do you feel any discomfort or any pain? And she does not. Okay, so we got that flushed. Okay, I'll take another alcohol, give it a little wipe again, and then we'll have our medicine. So you take the needle off, put that in the sharps container, push down, and twist to tighten it up. Okay, now this, remember I said, was going to be given over 1 minute. So I will take the volume that I have in my syringe and divide that by 4. And that means I will give that amount in 15 seconds and then the next fourth in the next 15 seconds. So you'll need a watch on and watch the seconds so you'll know. Okay, so I'm going to give just a fourth of this, 15 seconds, another fourth, 15, another fourth, 15, and we've got it all in. Okay, we'll remove this and we will get our next 3 ml flush, and we will let me take that alcohol and just wipe it just a bit, and we will push it in, turn it, and we want to flush at the same rate. So we'll put in about a fourth of it, and then in 15 seconds we'll do another fourth. So that final flush, you're going to do the same rate as your medication. Okay, so it is completely in now. So then I will clamp it. Clamping helps keep the blood from backing up into the tubing. Okay, now then I'm going to walk over here and get your IV tubing. This has a sterile cap on it as well. And I will get alcohol again. I will open up a new alcohol. And we're going to scrub that. Scrub that really good. Take this sterile top off. And I'm going to connect this. Okay, I failed to bring my tape over to tape it, so I just kind of tied it around it. Okay, and then you might want to also put a piece of tape along the tubing to secure it on the patient's arm. Okay, Mrs. Bird, this is going to take about an hour to infuse, but I'll need to go over and count the drops. So I'm going to walk back over here. And I noticed on my IV tubing bag that the drop factor was 15. Okay, so all these are clamped off. So I want to go ahead and unroll up, unclamp the secondary tubing that goes to the Rocephin. Okay, and then I'm going to control this one. Now I know that the drip factor is 15. And I have worked out the formula already, but I'm not going to tell you the answer because you need to do this for your video checkoff. But you will count your seconds. You'll be counting the drops per minute. So divide your number that you got when you worked out your formula. We'll say it was 24. So you would divide that by 4, and that's 6 drops. So every 15 seconds, you're going to hopefully get 6 drops. So you will regulate this, and you will be watching here in your drip chamber, and watching the second hand on your watch. Okay, you may have to go up a little bit to go faster, bring it down a bit to slow it down. Okay, we're getting there, just about there. Okay, so that means in 15 seconds, I want to have 6 drops. Okay, I got my 6 drops. Now then, for a full minute, I'm going to count it just to make sure that I have the correct number of drops. Okay, and I do. So that's running. Okay, Miss Beard, your IV is running. Do you feel any pain or discomfort, any burning? Okay, all right. Well, let me take a listen to you. Okay. Your lungs sound really good. And I do not see any jugular vein distension in your neck. And I'll just tweeze here between your eyes, and you have very good skin turgor. Okay, well, I think you should be set for this to infuse, and I will be back in about an hour to check on it. And I believe this is your last dose. So after this finishes, we'll be able to take it out. Alrighty, so I will be back in just a little bit. So let me take my gloves off. Dispose of my supplies. Wash my hands. Okay, I'll see you in a little bit. Bye-bye. Make sure call light's in reach, your bed is in low position. Okay, you're good. You don't need anything right now? Okay, you're good. All right, see you in a little bit.